According to British Heart Foundation, about 7.6 million people are living with heart and circulatory diseases. And in every 3 minutes, someone dies from having a heart or circulatory diseases. In every 5 minutes, someone is being admitted to the hospital due to a stroke. In a day, about 13 babies are being diagnosed of having congenital heart defect. In this video today, we'll be discussing about the warning signs of heart attack, how you can prevent it, the risk factors of someone having this heart attack, and what to do when an individual have an heart attack. That is what we'll be discussing in this video. Hello everyone, you are most welcome to my YouTube channel. Let's get started. But before we get started, if you're new on this channel, please click on the subscribe button so you don't miss any of my videos. Our hearts need oxygen to survive, and that is why there's a particular artery in the body that is responsible for this, which is the coronary artery. Now, heart attack occurs when the blood supply to the heart muscle is severely reduced or cut out completely. And this can be as a result of fat deposition known as atherosclerosis in this coronary artery. And when this happens, that is when you come up with having myocardial infarction or heart attack. What are the warning signs of heart attack that you should never ignore? The number one on my list is going to be chest pain or chest discomfort. A lot of people describe this type of pain as crushing kind of pain, like there's something on your chest. Mind you, this type of pain can either occur in the middle chest or the left side of the chest. And that is why if you notice, if you go to any hospital or any health provider and you tell them you're having a chest pain, they don't take it lightly, because it is one of the signs of a heart attack that should not be ignored. Secondly, heart palpitation. Now, you are having an irregular heartbeat. You can hear the way your chest is pounding. All of a sudden, you're having a pounding kind of heartbeat. This is not normal. You're not supposed to be having this. If you're not used to this, if this is not normal for you, it might be indicating that you're about to have a heart attack, and you should not ignore it. Thirdly, tingling sensation or discomfort in other parts of the body. Now, I know we are talking about the heart, but most of the time, it is not always centered around the heart alone. You can also experience other symptoms from other parts of your body. If you are experiencing discomfort on your back, on both of your arms, neck pain, jaw pain, it might be indicating a heart attack. As a matter of fact, women are more likely to have this kind of symptoms that I have listed as compared to men. So if you are having a tingling sensation or discomfort in other parts of your body that is not your heart or your chest, it can also be an indicator of you having a heart attack, and you should not ignore this. It is better for you to check this and to be sure that everything is okay. Fourth, shortness of breath. Now, you might be thinking that when you are having shortness of breath, there's something wrong with your lungs, because we all know that the lung is responsible for our breathing. Mind you, it can be an indicator of you having a heart attack as well. Suddenly, you become short of breath, you can't breathe well, and this is not normal for you. It's not like you have any other condition that could make you to have this type of breathing. It might not be your lungs. It might be an indication that you're about to have a heart attack. Abdominal discomfort. Yes, I know we're talking about the heart, but sometimes you can also have some abdominal discomfort like nausea, like vomiting. So it is possible that you feel nauseated, and this might have nothing to do with your stomach or your abdomen. It can be a warning sign of a heart attack. Cold sweat. Now, you might be having chills, you might be sweating on your forehead or your chest. If this is not normal for you, it might be a warning sign of a heart attack. If the weather says otherwise, it is not like the weather is indicating that, oh, you're supposed to be having this type of reaction, then do not ignore this sign. Dizziness and light-headedness. With heart attack, it means there is no proper supply of oxygen to the heart. And because of this, the heart will not be able to perform its normal function. The normal way it's meant to pump blood to other vital organs of the body, the heart will not be able to, because there is no supply of oxygen to the heart itself. Meaning the brain will not be getting enough oxygenated blood. And that is why you can can come up with having dizziness or having light-headedness, it is also a warning sign for you not to ignore. It is possible that all these symptoms that I have listed, you might not experience this one, or you might experience some of them. It is possible that you have other symptoms outside of the ones that I have mentioned. That is why you need to take note of your body. If you notice or experience anything that is out of norm for you, then it is worth checking with your health provider, so at least you'll be safe. Because outside of these symptoms that I have listed, it is possible that heart attack might present in another form. Remember that some women have certain symptoms that men may not experience, like pain on other parts of the body, like the jaw, the neck, and the back. That is why anything you notice that is out of norm for you, don't ignore it. Get checked. Please let me know in the comment section if you have experienced a heart attack that presents in another form from the symptoms that I have listed, or you know someone that had a particular kind of reaction that is different from what I have listed and they eventually found out that they had heart attack. Please let me know in the comment section so we can learn together. Now, what are the risk factors of having a heart attack? There are some things that can risk you to having a heart attack as compared to others. Number one is age. Men of 45 years and older are more likely to have heart attack as compared to young men. And women, 55 years old women and older, are more likely to have heart attack as compared to younger women. Also, if you smoke, smoking is one of the risk factors to you having a heart attack. High blood pressure, high cholesterol, obesity, diabetes, family history. Also, sedentary lifestyle, just sitting, not exercising, it can be a risk factor of you having a heart attack. How can you prevent heart attack? Eat heart-friendly food, make sure you're hydrating well, and ensure that if you're smoking, you can stop smoking. If you're finding it difficult to stop, there are a lot of smoke cessation programs online in the hospital that can help you to stop smoking. And as well, make sure you are living a healthy lifestyle. Exercise. It is not about you doing all this difficult exercise or going to the gym or anything. Walking alone is a good form of exercise for the heart. Make sure you're not sitting in a particular position for a long period of time. Also, pay close attention to your body. This is the only body you have in this whole life, so pay attention to your body. If you notice anything that is out of norm for you, get it checked immediately. And as well, get checked regularly. Do your check-up, let them check your blood pressure. All your blood work should be done, so that if there's anything that might be indicating any condition, you will know on time, and as well, it can be prevented. So make sure to get checked regularly. Now, what should you do when someone have a heart attack? If you are suspecting a heart attack, what should you do? First of all, you need to call the ambulance immediately. Call for help immediately. Do not drive to the hospital. If you try driving, this might occur while you are driving, and it can cost you your life and other people's life as well. So don't drive. Call for help at home. Also, if you're someone that is with an individual that's about to have a heart attack, don't drive them to the hospital. Make sure you call for help and let the ambulance come to you. As well, if you know how to do CPR, cardiopulmonary resuscitation, it will be safe for this person if you know how to perform this life-saving procedure. And as well, if prescribed to you, you can have your nitroglycerin or your aspirin. That is if it is prescribed for you, because this aspirin can help you to prevent blood clotting. But it has to be prescribed to you. Now, if you know you have a high blood pressure, you have hypertension, make sure you're taking your medication as prescribed, and make sure you're getting checked regularly. According to American Heart Association, you can reduce your risk of having heart attack up to 50% if you lower your blood pressure. So this should be another reason why you should maintain your normal blood pressure. If you're having a medication for it, make sure you take your medication as prescribed. Don't stop taking your medication. Don't stop taking your medication. Please always speak with your health provider before you stop any medication that is being prescribed for you at all. And thank you so much for watching today's video. I will link some of my videos in the description box so you can watch them as well. If you have not subscribed, please, what are you waiting for? Please do so to subscribe, follow me for more, and as well, like this video, help me share with as many people as you can. You don't know who this sharing of this video can save, who it can help. Let's educate ourselves. Please share this video, and you can also leave me a comment in the comment section, and I'll see you in my next video. Bye.